Good morning, everyone. Thanks for joining us today. Reach Talk Radio. This is Samantha Nephew, Sam, joining you today. Wishing my usual co-host, Stan the Man Martin, that he feels better. So he has left the reins to me today. So I hope I can do him some justice today. So today we have Jorge Valderrama. I didn't actually ask you, did I pronounce that correctly?
Yep, that's right.
Perfect. So as everyone knows, I am Sam Nephew. I am a healthcare advocate with the Healthcare Education Project. I've been on a couple of times now, so hopefully you know who I am at this point. But that's not the point. Today, we are here to talk to Jorge. So do you mind giving us a little overview of who you are, Jorge?
Sure. So actually, I work with Stan at CAI, so Ciccatelli Associates, Inc. And we're working on this COVID-19 initiative project in Buffalo, focused along the Ferry Street corridor. And the goal of the project is to raise COVID-19 vaccine awareness and confidence among Ferry corridor residents in the community. So a little bit of my background. I just started a couple months ago. So I think tomorrow is my 2-month anniversary of working at CAI. Previous background in mental health research, received a PhD from CUNY Graduate Center in Psychology back in 2016. Worked on a large-scale genetics project related to mental health at SUNY Downstate Medical Center in Brooklyn after that. And then previously to CAI, I was working at a community-based organization based out of Harlem in New York City. And I was brought along to kind of lead the research and evaluation efforts when it comes to this COVID-19 initiative.
So that's how I know you from the vaccine work that we've been doing, part of Healthcare Education Project and REACH, doing a lot of vaccine work. I didn't know you were Dr. Jorge.
Yeah.
Well, thanks for that.
Not medical, but yeah.
Right. All right. So I'm just going to get right into it. So I'm going to ask, what did the community needs assessment aim to learn?
Yeah, so we conducted a community needs assessment with residents along the Ferry corridor to just learn more about their own perspectives about COVID-19 vaccination itself. So we're really trying to get this effort behind of like, what do people think about the vaccine? What are their concerns about the vaccine? If they've had the vaccine, what are their experiences with it? What are the things that motivate them to have gotten the vaccine? For folks who haven't gotten the vaccine, what are things that may motivate them? And for the folks who really don't want to get the vaccine, like what exactly is preventing them from doing that? So the community needs assessment itself involved engaging nearly 500 community members, surveys, and all of that was done actually over the spring and summer from May to August of this year. And we hope that the findings of the community needs assessment itself will be used to identify best practices in developing messages about the COVID-19 vaccine, as well as generate implementation strategies to increase vaccination rates in our priority populations along Ferry Street and Buffalo-wide itself.
Mm-hmm. No, that's great. That's really important information. So what were some of the key themes that you found within this assessment?
Yeah, so a lot of things we found when it comes to actually what people think about with information as trust, things that help them motivate to maybe get a vaccine revolve around family and friends. So we found that family and friends play a substantial role in vaccination. So they can encourage folks to get vaccinated, but they can also dissuade individuals from not getting the vaccine. So we've seen that kind of like a consistent theme across the surveys. When it comes to the actual listening sessions and panels and community forums where people were actually allowed to like speak out and do Q&As with the presenters, that was something that they talked about as well. Is that I want to get this vaccine in order to protect my family and friends, or folks that just say that my father or my family are against vaccination, and that is one of the main reasons why I'm not getting it there. So you'll see this kind of like theme where there's a huge role when it comes to family and friends being involved in people's decision making.
Yeah, I have some personal experience with that. My little sister actually was not planning on getting the vaccination herself, but when it was offered at her job, she took it because she actually said to me, "I don't think I'm going to be able to see you if I don't get this. So how about I just get the vaccine?" And she's like, "It's for you." In my
Exactly.
head, it's for you, but I'll take
Yeah,
it.
that's the main thing. It's like, it's for yourself, it's for the community, things of that nature. So I think it's good. Yeah, I think we see that. I think actually one of the themes here also is just this idea that there are certain folks that are really not motivated at all to get the vaccine, but there are folks who are just on the cusp that need like an extra push, maybe more information, or maybe knowing different family and friends who've received the vaccine, they didn't have any bad side effects, things like that. So, a lot of this project is obviously reaching folks who haven't been vaccinated, but also reaching those folks who are kind of on the fence and kind of need, more information about the vaccine itself to get kind of encouragement to get it.
Yeah, I think I've seen a lot of times people just don't even want to go to their doctor's office. They think it's something you need to go to a medical facility for, something that they want to do. So if it's offered in different places, that can also be the push.
Yeah, that's an excellent point. One of the things we saw, people were more comfortable going to their own primary care doctor for getting the vaccine versus like going on a long line in some sort of other format to actually get the vaccine itself. So yeah, that's I think really great information to know. So one of the key themes that we found, which is I think doesn't really come as a surprise when it comes to the community and what we've heard about how people's thoughts are of the vaccine across the country, was just this general mistrust in medical providers and the government is prevalent. And I'll go into like more specific detail about that in a little later, but it's something that we saw across the board with surveys, with like the panels and the forums where people were outspoken about that. Another important theme that we found was that there's widespread misinformation, really leads to a lot of uncertainty about like what is fact or fiction. We're getting all this information from like social media, from friends and family, from the news, from government officials, from former presidents, from like current presidents, all this stuff. And like, it's hard to pin down what exactly is fact, or fiction. So it makes people, if you have all this information and it's all conflicting, it makes it difficult for them to make a choice when it's just so much information to sift through. And, it's easy to forget that, a lot of individuals have very busy lives with like, obviously work and childcare and things like that. And they're just like trying to go day by day in that method. So I think that's an important theme that we also found as well.
Absolutely. Sometimes I forget that I'm the weird one that spends my days surrounded by, doctors and researchers at UB and things of that nature. So I trusted the science and I trust the doctors and the people that I work with in this vaccination work. But then I would come back to my friends and people in the community and they're like, wow, you're really trusting of the government. That seems really not like you. And I'm like, no, that's not where I'm getting my information from. So yeah, a lot of misinformation, a lot of, trusting your friend's uncle's best friend on Facebook and whatnot. So
exactly. That's definitely a theme. I think that's, it's been a common occurrence, not just COVID-19 vaccine related, but just news in general in the last several years.
Yeah, absolutely. So in your findings, how many people said that they got the vaccine?
Yeah, so for the survey that we implemented, it was interesting because it was like 61% of adults and 41% of youth, which in this case were considered people between the ages of 12 and 20, had been vaccinated. Actually very similar to what the current rates are Buffalo-wide and actually within the zip codes along the Ferry Street corridor. So I think we got a pretty good representative sample when it comes to that because as of earlier this week, 68% of adults had been fully vaccinated in those areas, and around 45% of youth have been fully vaccinated as well. So kind of similar. I would say when you kind of go down into specific zip codes along the Ferry Street corridor, there are actually more, like there's, 3 of the 5 zip codes are around 50%. So a bit lower than what we're seeing across the board. But I think overall, we did get a pretty good representation of how this reflects the vaccination rates in Buffalo.
So there's still work to be done, but it sounds like we're doing all right.
Yeah.
The work is not in vain.
Yeah. And I would definitely like the caveat to that was that this was information collected over the summer and through August, and with different mandates and different maybe jobs implementing those mandates for people to get the vaccine, that there could have been uptick as well. So I think we'll have maybe more of those folks that took those surveys actually have been vaccinated at this point.
That's probably a whole different show
Yeah.
about that. But yeah, no, definitely. So tell me, what motivates or deters people from getting the vaccine? What'd you hear out there?
Yeah. So as I mentioned, yeah, definitely. I think the thing that we saw the most was family and friends. So motivated the vaccine to protect family and friends. A lot of people mentioned, living with individuals who are older, who might be immunocompromised or just maybe more susceptible to more negative or harmful effects of COVID-19. So I think that is something that motivates them. Obviously, also to protect their own health. And folks also mentioned to protect their own community. Youth are more likely than adults to say that they want to get vaccinated to get back to social activities and to resume school or even work as well. So I think when it comes to actual motivators, those were kind of the main things that we found about that.
Mm-hmm.
And when it comes to actual deterrence, again, yeah, family and friends contributing to hesitancy or reluctance, the mistrust that there is when it comes to the government, public health agencies, medical providers. This came up a lot, just the historical trauma of events. For example, the Tuskegee study contributes to mistrust of the government, ongoing reluctance to vaccinate. So I think that is still obviously, it wasn't that long ago, and different things have happened besides that in the past where communities can be, frightened of the fact of getting a vaccine that was obviously developed very quickly just because of, the public health emergency behind it. Another thing about deterrence, yeah, many individuals that we surveyed could not tell whether information they learn about the vaccine is true or false. So you're getting this information, you're not really sure, you're hearing about these side effects that some people said they had, and then you have kind of more government-oriented entities saying that this is not what's happening, and if there are side effects, they're very low. But people not trusting those numbers. Deterrence also, yeah, vaccine side effects that have been put out that it does occur, that you can have full body fatigue and just feel like tired after maybe the second shot or maybe just the one shot of the J&J. Mm-hmm. So people, kind of what you hear about with like the flu vaccine too, where people think that like, okay, I'm going to get this flu vaccine, but I'm going to get the flu, or like here, I'm going to get COVID-19 symptoms, things like that. So I think those are things that also contribute to that.
The old, I'm going to get sick anyway, right?
Yeah, exactly. And of course, the important point that to be made there is that, yeah, there could be some side effects, but all about like that benefits and like what's going to outweigh like the cost of these different things, because the potential, obviously detrimental effects of COVID-19 is worse than the actual side effects that can happen to some people. Mm-hmm. Concerns about the content of the vaccine. So people, thinking that vaccines include live viruses, which is not the case for the 2 different types of COVID-19 vaccines that are available in the United States. Just to round out about that, just more of this distrust when it comes to the medical community and the government. I think a lot of that combined, all those different things can just make someone be like, okay, let me just step back.
Yeah, I think that's why some of my friends, wow, you're really trusting of the government. I'm Native American, so there's some history there. So some of
Hmm.
my friends were quite surprised that
Yeah, of course.
I got it when I did, but
Hmm.
hey, I got the shot as soon as it was available to me.
Yeah.
Uh,
Hmm.
so you kind of talked about it a little bit, about the distrust and am I getting the right information? So who are people looking to get trusted information about the vaccine?
Yeah. So one of the things that we looked at was like, how are we going to compare the people that we spoke to who are vaccinated versus unvaccinated? And so vaccinated folks are more likely to trust the CDC and even their own primary care providers than people who are unvaccinated. It's still pretty low. I mean, I think it was around 55% of individuals who are vaccinated trusted the CDC versus 30% unvaccinated. And those were similar numbers when it came to like their primary care providers too. So there's still people who are getting vaccinated still have this distrust, but I think what's making them cross that line of getting the vaccine is that family and friends, and protecting them. So I think that's definitely the main theme that we got from there.
Okay, great. So it's not necessarily Dr. Fauci on the Saturday morning news that people are looking to.
Yeah, I think, yeah, it's one of the things. I think a lot of people, you see that information and it's out there, but I think the people who are not getting vaccinated, something that came up actually recently when we were talking about this with some colleagues, was that there is this idea of like fatigue when it comes to hearing about you need to get the vaccine, you need to get vaccine. So it's like when you're having these different avenues of information being brought out to the public, that people who are really really reluctant, like, just don't want to hear about it right now. Like they'll continue to wait and see how things go, and it could take a lot, because one of the things I failed to mention here, which I think is also another important finding, was that a lot of the folks who are not vaccinated did have very personal experience with the actual disease. So they knew individuals in their community and their family and friends who had been seriously ill, hospitalized, or even died. And they said that even that is not making me actually want to get the vaccine. So that's something that
Wow.
is an important as well, is that that's how far it can go when it comes to the actual distrust or just wanting to not. And also the mentioning that, they never trusted any type of, flu vaccine or other things that are
Mhm.
being put into your body. So it's definitely a barrier for sure.
Which is wild to me when people say things like that, because so most people go to like public school, and to be enrolled in public school you had to have had different vaccines
Hmm.
or to attend. So it's just trying not to judge.
Yeah, yeah. I mean, I think it's an important thing because, like, at this point, I think, yeah, it's like there's all the information out there. Like, that's something that's there. I think one of the things that, for us at CEI that we definitely want to put across is that, like, it is the personal choice. It is, we can give you as much information as possible. You do your own research, and, it's up to you about what exactly you want to decide for your own self. And definitely the goal of this community assessment, as I mentioned, was just trying to find these different attitudes. What exactly are different ways? If for people who are thinking about it, what are different motivators that could potentially put them kind of over that line? And it's also something that I think as we go into the winter, and presumably like the flu season will be a pretty rough one, just because last year it was not so rough because people were socially distanced, were inside, wearing masks. But now that more people are out and about, they're more likely to have kind of a more like rampant flu season. So one of these things too is like, okay, how exactly do you communicate needing to get the COVID-19 vaccine while also getting the flu shot this year to prevent even further illness? And that's one of the things that I think people have to, put upon themselves to like learn about the different things that are involved with these vaccines, and that obviously that is their choice to, actually want to get the vaccine.
Oh, absolutely. I mean, I'm committed myself to making sure I get the flu shot. Yes, I might
Hmm.
get sick anyway, but the point is that I don't want to end up in the hospital. I don't want
Hmm.
to pick up a bed. I don't want to do
Hmm.
any of that. Leave it for people who need it. So that's why
Yeah,
I
and that's an important point. I think that's something that's been put out there is that, the less people who are sick with flu, the more people can handle who are, sick with other things going on. So,
absolutely. You
yeah.
don't want to overwhelm the system. We've been
Yeah.
talking about that for a year and some change at this point. You don't want to overwhelm the system.
Yeah.
So you started to go into it a little bit about the fatigue, which is real, but people like myself, people like Stan and CAI and all of that, we need to keep educating. We need to keep talking about this until we get to a point where we can kind of return back to a normal life, quote unquote. Um, but what are the different ways that vaccine motivation can be increased? That's always something that myself as an organizer, I'm trying to figure out.
Hmm.
How do I avoid the fatigue? How do I get people engaged and, at least educated on their options?
Yeah, so a lot of the folks that we spoke to mentioned kind of specific areas where, I think things that have been done, but it could maybe be done in other ways, but just, offering incentives for individuals. So like, hosting free concerts or other events made directed to specific age groups, especially when we do know that the vaccination rates across the country for youth are pretty low. So just like having these events act as something that like, okay, you're going to be entertained, but also it could be an education form as well, where people talk about the vaccine. And it could be like pop-up tents where if you want to get the vaccine, go ahead and you're available to get it. So giveaways such as VIP concert tickets or like different items that can appeal to teens. So people like, I think some young folks mentioned like free food, like, going to like, a local, restaurant or one of their favorite hangouts and just like, okay, I can just get this. So I think that's one of the things that have been mentioned, but also something that could be hesitant about because there has been news out there where people hear about incentives and it's like I'm not sure about like why you're trying to like put me in this raffle just so I can get this shot.
Mm,
I shouldn't need to be forced to get not
right.
forced, but like incentivized in that way. So it's a very fine line, I think, and I think it's really dependent on the person and the people who kind of interact with that type of messaging. So I think that's important as well.
Yeah, no, I remember I believe it was the summer, maybe it was late spring, Erie County did a thing where they offered a beer and a shot. Literally, you would get
Nice.
free beer, and then, they would also give you the shot. And I believe it was pretty successful for a while.
Yeah,
But yeah,
that's
the
funny.
incentives
But
definitely, I know. I
yeah, there's been
kind
a lot of things like
of
that.
love that one.
Yeah. Um, yeah, like one of the things like Stan had mentioned in one of his events, that youth had indicated having support from like Buffalo Bills players. The organization itself could increase like vaccine uptake. I know that's something that's happened too, where players have been more outspoken about getting the vaccine. So I think having like those type of public figures, where either youth or sports fans look up to, and it's like, okay, that could be something that motivates them as well.
Mhm.
Um, One of the things we also heard were just like, sharing testimonials about community members' own experience with fighting COVID-19 and why they got vaccinated. And I think that's something that happened during one of our panels where the panelists did speak about that, having like, that kind of experience in getting the vaccine. And just knowing that hopefully, obviously, that can prevent them in the future from getting further illness or just being more seriously ill. So I think those type of community members where either, yeah, recognizable individuals or people that just live in the community and they know that they're, one of their neighbors experiencing
Mhm.
that as well.
So I know the assessment was done over the summer, and the talk about vaccinating younger kids, 5 to 12, is increasing now.
Mm-hmm.
Did you get any sense of how people feel about the vaccine for younger kids, by chance?
So not those weren't specific questions that were asked about it, because at that point it had just been recent that people 12 and older can get the vaccine.
Sure.
But I would say that I think that's something that's definitely that like we'll like us in our organization want to and are already in the midst of talking about different type of messaging when it comes to that, because we know that's a whole other hurdle when it comes to having that type of talk. We know, when it comes to the flu vaccine, any child 6 months or older are recommended to get it. But I think many people will forget about that. And I think overall, like, rates for youth are pretty low when it comes to flu vaccination. But when for this age range that will be new popping up, yeah, I think that's going to be another like challenge to just try to get messaging behind that, and what exactly would be the best way to go about that, because I think it is different. It's definitely like during that age group.
Mm-hmm. Absolutely. So is there anything else that you can think of from your assessment, from the work that you do in this? Anything else that you'd like to mention that we haven't really talked about yet, or any ideas for next steps as we continue this work?
Yeah, I mean, I definitely want to mention that one of the things that was also talked about from these participants was providing more opportunities for community forum sessions for individuals to talk about the vaccine. So I think these are people who are like more on the fence and want to hear more about it and ask questions, because I think in those type of learning events, you can be likely to, have someone, have, I guess, learn or have more education about vaccinations and like the benefits of getting it. And one of the important things also is that this idea of family and friends and kind of just this one-on-one approach of, having folks, if they're encouraged to vaccinate, if it's just one person, obviously encouraged to vaccinate, kind of can lead to a domino effect where they're talking to their family and friends, like, this is why I got it. This is what is happening. So I've mentioned, like, during these different pop-up events, and maybe only a hand of people get vaccinated. I think that's excellent, because that might just be a small number there, and be, obviously better if it's more, but like those individuals themselves can like influence other people as time goes on. So I think that's important as well. And I think, yeah,
I feel really good about that, by the way.
yeah,
To know, because like I said, as an organizer, I'm constantly putting these events together, or putting, graphics or whatever on social media, trying to get the word out there. Sometimes I feel like I'm screaming into the void, but
yeah, it's difficult.
sometimes you can convince one person. It's
Yeah,
worth it.
yeah, because I think it definitely, that's how it can lead to more,
Mm-hmm.
And I think, yeah, when it comes to just next steps, what we're doing with the findings of this community needs assessment is that, yeah, we're, right now, yeah, want to share the findings out in the community. I think it's very important. They were obviously integral in finding about all this information. So, like, yeah, share the information back to different community partners and different folks that we work with. And hopefully, as time goes on, yeah, like just using this information to develop these different strategies that can increase confidence and uptake in the vaccine.
All right. Perfect. Well, thank you so much. We're just at about time here. Thank you for giving us all of this information, and, the findings from this assessment, that this information is so critically important to making sure that we get people educated on the vaccine. And again, even if we convince one person on this show to go get vaccinated, this was a success.
Yeah.
Or at least talk about it with other people.
Yeah. That itself. Yeah.
The information. Absolutely. In any event, reach out to CAI, Reach Buffalo, Healthcare Education Project. If there are any questions about the vaccine or the what's going on with the pandemic, please make sure you ask us. If we don't know the answer, we know somebody, like Dr. Jorge here. Somebody knows the answer to the question. So thank you so much for joining us today.
Thank you. Thank you, Sam. Have a great one.
You too.
Thanks. Bye.
Reach Buffalo, promoting a healthy community. Reach, racial and ethnic approaches to community health locally in Buffalo to reduce racial and ethnic health disparities and rates of chronic disease. We want to make a change by reducing exposure to tobacco in housing and work areas, by increasing access to nutritious foods, by creating a breastfeeding community, by increasing referrals to primary care and community health providers, and by implementing community work groups. Reach Buffalo will concentrate on Ferry Street itself, as well as a community that resides within 4 blocks to the north and south of the corridor in 5 zip code areas: 14208, 14209, 14211, 14213, and 14215 in Buffalo, New York, with disparities in rates of chronic disease. Get involved. Ferry area residents will have an opportunity to have a platform to voice their opinions, organize, and make decisions in these efforts. For more information, you can contact Ebony M. White, Community Outreach Coordinator, at 716-268-2954.